All right, let's move on. Lots of people talking about mental health today. We talked about this last year. It certainly seems like we're talking about it more, but has that translated into action or results?
Well, what's that line? Don't get me started.
Yeah, exactly.
Yeah. So first of all, mental health is the poor cousin in health care. So for every dollar that's spent in health care, it is a small fraction that is directed to mental health. And then in mental health, children's mental health is the poor cousin to mental health generally. And so these are situations that are grossly underfunded. That's why myself in private practice, I'm still busy as can be, because people have to pay out of pocket for services that might best be delivered in through the public system. I see so many folks where, particularly in children's mental health, where we have to wait till somebody is suicidal to access meaningful service in a timely basis. It's not that people don't access services, but it isn't timely. And so if you have a mental health challenge, to be, drying on the vine, so to speak, that only exacerbates the situation. We have standards in place for things like cancer care, where we say, hey, if this kind of cancer, these kinds of issues, the standard of care says that you should be seen and treated within, so many days, weeks, or months, whatever it is. We have nothing like that in mental health care. And it's about time we started establishing some standards by which people should have access to treatment. There's my rant.
Where does depression fit into mental health? Do people realize depression is a mental illness, especially because it comes in varying degrees?
Right. So you can have depression light, so to speak. You kind of feel blue, you're off, and it can be short-lived and relative to something going on in your life. You may not need much to get over that. Or you can have much greater degrees of depression that seem to be there whether or not there are other things going on in your life to help us understand the depression. So, or you can be so depressed that you can't get out of bed and you're contemplating taking your life. So absolutely there are different degrees of depression. What used to be the common thinking, just pick yourself up by the bootstraps, get over it. That's not what this is about. You wouldn't use that conceptualization with somebody who has diabetes. You wouldn't say, oh, come on, your sugar can't be that low. Think yourself through it. Feel yourself better. So these are situations that really do require help. The kind of help that you would need depends on the kind of depression you are suffering. So some folks will do well with counseling. Some folks will do well with medication. Some folks will actually do well with a change of diet and exercise. And some folks need a combination of all the above. So you need to see a treatment provider who's well-versed in these issues, who can help differentiate your kind of depression or your kind of mental health issue, and develop a treatment plan that's sensitive to your cultural values, your health needs, and your ability to attend sometimes. You need to see the treatment provider to sort that out, and we really want to encourage people to do so.
Are you born with depression? Is this something that manifests itself over time? Because, you can, I've known situations related to my own circle of friends and family, which ended up in a suicide. Mm. And, as you look back, as you look over time, you could see things that weren't right, but just weren't that serious at the time, but sort of grew over time. Does that happen, or is it something you're born with? How do you get to this point?
Right. So we refer to that as the nature versus nurture controversy. Were you born this way? Is it by nature? Or was there something in your environment that gave cause to this? Is it nurture? And the truth is it's both, and to varying degrees. So in some families, we will see a history of depression in first level family members. It could be a sibling, it could be a parent. It could be an uncle, could be an aunt. And we'll be able to trace and say, you know what, this person, this person, this person, and this person, there may be a good basis for considering a genetic component. In other circumstances, we see people who have been subject to trauma in their lives. We see this a lot in our first responders. We see this a lot in our military, where the result of repeated unresolved trauma creates an emotional disturbance, so to speak, can lead to depression. So sometimes it is nature, it's innate, there's something biochemically that we were brought into the world with, and other times it is the environment, and sometimes, like I say, it's a bit of both, where if you have that genetic predisposition, factors in your life can trigger the depression.
How do you get somebody who you believe is in this state, how do you get the horse to water? How do you get them to realize they need help?
Right. So that takes a very frank, forthright, and sincere dialogue. Not beating around the bush, not wondering, not oh gee whiz, but you sit down with the person and you share your concern, your heartfelt concern for them. And it's, hello, so-and-so, I've just noticed that you've been off the last few days, weeks, months, and I'm worried for you and your well-being. I'm wondering if you're not feeling depressed, and if you are you getting help for it? So we need to open up the discussion. We can't be afraid of opening up the discussion. Opening up the discussion isn't going to cause the person to feel depressed. If they're already depressed, they're depressed. This is how we open doors. We talk about it.
How do you get help once you've decided that's what's needed?
Most people are going to start with their family doctor. The family doctor tends to be the gatekeeper or gateway to other healthcare systems. I would certainly encourage people to speak with their family physician. Here in Hamilton, we're kind of blessed. We have a lot of healthcare teams. So these are doctors' offices that are likely also equipped with social workers and other kinds of therapists along with the medical team to help with mental health concerns. Speak with your family doctor.
How do you get the person who needs the help to understand that the counselor is there to help them, therefore telling the truth, being forthright? I mean, it's like anything. I guess it's not like anything. I mean, if you go to the doctor and you've got an illness, they can tell whether you're sick or not. In situations like this, how important is it for the patient to be honest and forthright about what they're talking about to allow the expert to get to the point?
So I actually don't recommend that people cajole their friends and family members. Tell the truth. You got to tell the truth. That just creates a sense of fear, shame, and intimidation for the person who is seeking help. Let the therapist worry about forming some rapport with the person, such that the person feels more at ease and compelled to be forthright with what's going on in their life. So we don't want to overwhelm the person who may be seeking therapy before it even begins. The other thing to recognize is, for many folks, seeking therapy is they feel it is stigmatizing. You don't like it to be, but that's a simple fact. If you can't necessarily get the person who appears to need the service to counseling, then you, as a family member, you go to counseling for yourself. Because the truth of the matter is, mental health problems, their relationship, and family problems too. And we, the general public, we're loaded with many myths about what it is, what it's about, how to be helpful. So by you going for counseling, and we have a name for it, psychoeducational counseling, you're going to learn about this so that you can feel better yourself in working with your friend or family member. So when somebody does phone me on a mental health issue, it's actually rare that I will ever meet with them on their own. I'm always asking them to bring a friend or loved one in with them, because that's part of their support network.
Fascinating. And, of course, hopefully we'll continue this discussion more than just on today, which is seemingly a national day to chat about such a thing. Gary Dierenfeld has been with us, social worker, yoursocialworker.com to find out more. Gary, as always, thanks for the time and the insight. Much appreciated.
I'm so thrilled we could talk about this today. Thanks, Scott.
Thanks, Gary. It is...